You have a whole kind of a theory of how to interact with people who live with memory problems, Alzheimer's disease, and other dementias. So what is your basic philosophy theory of how it should be done?
Right. So I teach something called embracing their reality, which essentially means that you're getting into the world of the person living with dementia and not being hung up on where the truth of our reality is. This is really hard for a lot of caregivers because they really want to help the person with dementia understand the truth that we're living in. But unfortunately, what's true for us is not always true for the person with the cognitive impairment, as caregivers see all the time when they try to argue with the person and say, "No, Mom, don't you remember? Dad's been dead for years." And then Mom gets upset. She says, "What do you mean? I don't remember him dying," and now we have a whole thing. So most people who work in my field who kind of came before me in terms of dementia care teach validation, redirection, distraction, which essentially mean that you are, quote unquote, not allowed to lie to someone with dementia. And it just has always felt so black and white to me. Because if you tell a caregiver, well, you want to live in their world, but don't lie to them, the caregiver's like, what does that mean? Because I don't know what that means, in practice. That's such a, you can do this, but you can't do that. And so in practice, you lose people because they're just not really sure, where the line is, what they're allowed to do. Yeah.
Kind of like telling, trying to figure out what you're going to say next, because you're trying to draw the line between, well, I don't want to upset the person, right, but I also want to be truthful, and I have to think a lot about how to do that, right?
Yeah, so I teach people to ask a question, like when someone's saying, "Where's my mom?" to say, "Where do you think she is?" And then if they say, "Oh, I think she's at work," you're going to say, "Yep, she's at work." If they say, "I think she's, on vacation," "Yep, she's on vacation." "I think she passed away." "Yep, she passed away." You're just going with whatever that person's reality is, so you don't get stuck saying the wrong thing. And again, what's true for us is not always what's true for them. So you can't rely on the truth as the playing field, as the level playing field, because it's not like a reliably level playing field in this scenario.
Something that I saw that was kind of interesting, it was 3 questions to ask. Can you talk about that?
Sure. I mean, really, I could talk about this all day, so I'll give you the very short version. The first question is to use when communicating is where you think they are, which is what we talked about a little bit earlier of, if someone's asking, "Where's my so-and-so?" to say, "Where do you think he is?" The other 2 are, "Can you help me?" So when you're engaging in a program or activity, to ask the person for help, instead of saying, "Do you want to do this thing?" saying, "Can you help me with this?" makes them feel important and needed. And the third question is to say, "What do you think about this?" when you're introducing a stuffed animal or a baby doll. So you're not saying "Look at this dog." You're going to say, "What do you think about this?" And then, if they think it's real, you think it's real. If they think it's a dog, like a stuffed dog, then you think it's a stuffed dog. You just go with wherever their reality is, so you're not telling them what is true for them.